It started with a sound I'd heard too many times in my career. The sharp, high-pitched beeping of a monitor sliding from steady to frantic. I was halfway through documenting a set of vitals when I glanced up and saw the numbers climbing across the screen above bed 14. His oxygen saturation was dipping, his heart rate spiking in an erratic rhythm that made my stomach twist. I abandoned my charting and hurried to the bedside. Mr. Price, mid-30s, wiry build, admitted 3 hours earlier for severe stomach pain, lay sprawled across the sheets, his skin slick with sweat. His chest rose and fell too quickly, each breath shallow and ragged. "Mr. Price?" I leaned close, pressing my stethoscope to his chest. His lungs crackled with fluid, though his history showed nothing about CHF or pneumonia. I glanced at his IV fluids, checked his lines, scanned the meds we'd given. Everything looked ordinary, on paper. But his body wasn't ordinary. Something was wrong. I pressed the rapid response button. Within minutes, the room filled. Residents, the attending, respiratory therapy, another nurse to help. I rattled off what I had. 35-year-old male, abdominal pain on admission, stable until 20 minutes ago. O2 sats falling, tachycardic, wet lungs, not consistent with history. The attending frowned, already sliding on gloves. What history? Appendicitis suspected. No cardiac or pulmonary history reported. But even as I said it, the words sounded flimsy. His chest screamed otherwise. We tried to stabilize him. Oxygen, labs, an ABG, a stat chest x-ray. The x-ray showed fluid, but not pneumonia. His blood pressure began dropping, heart racing faster, a dangerous spiral. "This doesn't make sense," the resident muttered, scanning labs as they printed. "His kidney function's off. Lactic acid elevated, but nothing in his story points to why I stood at the bedside, hand on his wrist, pulse thready beneath my fingers. And in that moment, I knew. He had lied. Patients lie all the time. About smoking, about alcohol, about meds they forgot to mention. But this was more than that. This was a lie big enough to kill him. The team intubated him when his breathing collapsed into gasps, the tube sliding past his vocal cords as his chest bucked. I hung intravenous medications with shaking hands, adrenaline high, every move automatic. But my mind spun. What was he hiding? After the dust settled, temporary stability achieved, ventilator hissing steadily, the room emptied, leaving me to clean up the chaos. I stared at him, pale and still beneath the tubing, and the unease in my gut coiled tighter. I pulled up his chart. The history was bare: healthy male, occasional drinker, no surgeries, no chronic conditions. He'd come in through the ED with severe abdominal pain, denied trauma, denied substance use. His labs didn't match that. His lungs didn't match that. I scrolled further. Notes from the ED were brief, rushed. He'd insisted on just stomach pain. No details, no timeline. And that was when I noticed the bruises. They weren't obvious, not at first glance. But as I shifted his gown to check his central line site, the faint mottling across his flank caught my eye. Old yellow-green fading into purple. Not appendicitis bruising. Not from 4 sticks. Trauma bruising. My chest tightened. The next round of labs confirmed my fear. His liver enzymes were through the roof. His kidneys were tanking. And yet, he had denied drinking. Denied drugs. Denied any trauma. By the time the attending circled back, I had pieced together enough suspicion to open my mouth. "Something's not right," I said, gesturing to the labs. "These numbers don't happen from nothing." And look, bruising, right side. The attending frowned, lifted the gown himself, then exhaled sharply. He didn't say anything about an accident? "Denied trauma," I said. The doctor swore under his breath, already calling radiology for an urgent CT. Hours blurred into tests and consults. The CT showed what we all feared: a ruptured liver lobe, likely from blunt trauma. Blood pooling internally, now stabilized but far from healed. Combined with failing kidneys and fluid in his lungs, the picture was clear. Except the story wasn't, because according to him, none of it had happened. When he woke, sedated but conscious enough to squeeze my hand, I leaned down. "Mr. Price, we need you to be honest. Something happened to you. This isn't just stomach pain. If you don't tell us the truth, we can't treat you properly." His eyes darted away. Fear, shame, maybe both. His lips moved around the tube in his throat. Words caught in silence, and in that silence, I knew again. He was hiding something that could cost him the rest of his life. That night, after the shift change, I sat in the charting room, replaying it all. A healthy young man doesn't just show up with a ruptured liver and failing kidneys from stomach pain. He'd lied, and the lie had bought him long-term damage we couldn't reverse. Dialysis loomed, months of recovery, maybe permanent scars. But why lie? That question gnawed at me, long after the monitors quieted and the unit dimmed. By morning, his labs were worse. Creatinine climbing, potassium unstable, fluid still seeping into his lungs despite diuretics. We kept him on the ventilator through the night, lines running from every direction, the steady beep of his monitor marking the rhythm of our work. The attending gathered the team for rounds, flipping through his chart, his voice tight with frustration. "This isn't sustainable. If we don't get the underlying cause, we're treating shadows." "Someone needs to get the truth out of him," I volunteered. When sedation was lightened for neurochecks, I sat beside him. His eyes flickered open, glassy with pain but aware. I took his hand. "Mr. Price," I said softly, "we found injuries that don't match what you told us. Your liver, your kidneys, they didn't just fail on their own. If you keep hiding things, we can't fix this." His lips trembled around the tube. He blinked rapidly, eyes shining, then squeezed my hand once. I leaned closer, reading the desperate flicker in his gaze. He wanted to speak. I called respiratory to give him a trial off the tube. It wasn't easy. He coughed, sputtered, voice a raw rasp, but he managed to get words out. "I fell," the word barely audible, like it had been dragged through gravel. "Where?" I asked gently. He closed his eyes. "Construction site. Scaffolding." My chest tightened. "You fell from scaffolding? How high?" He winced. 2 stories. Landed on my side, I almost swore out loud. 2 stories. That explained everything. The bruising, the liver rupture, the kidney trauma. But another question pushed through. "Why didn't you say that when you came in?" His breath hitched, tears spilling. "No insurance." Boss said, "Don't report it." Said if I told, I'd lose my job. Couldn't lose work. Needed the money. And there it was, the lie that nearly killed him. The doctors confirmed the story matched his injuries. It explained the fluid, the organ damage, the spiral into respiratory failure. We adjusted his treatment plan. Dialysis scheduled, surgical consult for his liver, closer monitoring of his kidneys. He wasn't out of the woods, but at least now we had a map. Still, the truth came too late. 2 weeks later, when I visited him on the step-down unit, he was awake, breathing on his own, but tethered to a dialysis catheter. His skin had a yellowish cast, sclera tinged faintly. His voice stronger but edged with fatigue. "They said my kidneys..." He trailed off, staring at his hands. I nodded gently. "They've taken a lot of damage. Dialysis will help, but there's a chance they won't recover fully." His jaw tightened, all because I kept my mouth shut. I didn't argue. He already knew. He told me bits and pieces as days stretched into weeks. The construction company had cut corners. No safety harnesses, no proper equipment. When he fell, the foreman panicked, promised him some cash if he didn't report it, threatened to fire him if he did. He was desperate, rent due, family relying on him. So he lied. He walked into our ER claiming stomach pain, thinking maybe he could ride it out. Maybe it wasn't that bad. By the time his organs began failing, it was too late. I listened. That was all I could do. Nurses are trained to save people's lives, but no one trains you for the part where they destroy themselves out of fear or shame. The long-term damage was irreversible. Dialysis 3 times a week, possibly for life. Even if he qualified for a transplant someday, it would be years of waiting. His liver would scar over, leaving him vulnerable forever. One evening, while I was adjusting his IV, he looked at me with eyes full of something heavier than pain. "You think I deserve this?" "For lying?" I paused, the tubing coiled in my hand. "No, I think you made a choice out of fear. But the truth is, your body doesn't care why you lied. It only reacts to what's real. That fall hurt you, and hiding it didn't change that." He swallowed hard, gaze dropping. "Feels like punishment." I didn't answer. Not because I agreed, but because sometimes the silence says more than words. Weeks later, when he was discharged, he shuffled out with a portable oxygen tank and a schedule full of dialysis appointments. I watched him leave, shoulders hunched, the weight of his lie stitched into every step. He would live, but life, as he knew it, was gone. That night, as I closed my shift, I thought about the dozens of little lies I'd caught over the years. Patients denying smoking with nicotine stains on their fingers. Diabetics swearing they avoided sugar while sneaking sodas. Alcoholics denying drinks with blood alcohol levels, screaming otherwise. Most lies we caught in time. This one we didn't. And I realized, in the quiet hum of the unit, that the worst damage wasn't always from disease or injury. Sometimes it was from the silence, the secrets, the desperate hope that hiding the truth could change it. But the truth always comes out. And sometimes it leaves scars too deep to heal.